Fusion MRI works by having the patient go getting a regular MRI in an MRI machine. And what we're looking for is specific lesions in the prostate. And from those lesions, we decide whether or not you're going to get a biopsy in our office. So it's kind of a two-part process. So the paradigm is shifting with Fusion MRI biopsying by targeting lesions that are seen within the gland on your MRI. That process of getting the MRI Fusion biopsy is relatively straightforward. You go to get an MRI at one of our UPMC facilities. If there's a lesion on there, on the MRI, you then come to our facility at UPMC and we biopsy that specific prostate lesion in the offices, and we'll get generally get a more accurate feeling for what those lesions are then. The clinical implications of MRI fusion is that we're really honing in on cancers that are clinically important to our patients. There are several well thought of papers published in JAMA, for instance, that have shown that this technology finds high risk tumors and intermediate risk tumors at a much higher frequency than we had priorly, excluding lower risk tumors to some degree. And that's really where we want to be with prostate cancer care. We really don't want to find a lot of prostate cancer that is low risk or slow growing for patients, because it adds stress, and unneeded stress in many cases, because they don't need to be treated. And this technology really hones in on those tumors that we think need to be treated, and that's why it's a very important new technology. Fusion MRI and prostate cancer diagnosis is really the new frontier in how to diagnose prostate cancer. First thing to remember is that it's for patients that have generally had negative biopsies already, and their PSA or their blood test has been escalating. That's the population of patients we've been targeting. The second thing is, of those patients, this technology finds important cancers, generally doesn't find the slower growing cancers. And the third thing is, if you have a negative MRI, that should give patients a nice feeling that the chance of them having a significant tumor is approaching zero.